morning and welcome to Jack's senior speech. Jack has some special family and friends here today. Please give a warm welcome to his parents, Scott and Harriet, his brothers Will, Ben and Hank, I think they're here, and also some other special guests, Augusta Mums in Prayer, Jane Houston, Dina Taylor and Betsy Hustis. So if you see them in the back, make sure you say hello to them. Jack joined prep in his 9th grade and has grown into a very tall, respectful young man, one whom his brothers can look up to as an excellent role model. I had the great honour to celebrate the great achievement of Jack's a few years ago when he became an Eagle Scout, which, as you all know, is regarded as a very prestigious award in the Boy Scout organisation. Well done, Jack. As you all know, Jack is a keen participant in track and basketball. He sings in the prep choir and he also tours with his youth choir at Trinity on the Hill Church. He also attends Reed Memorial Church, so he's a very busy young man. Today, Jack is going to speak to you about a life-changing event that happened to him not so long ago. Please welcome Jack to the podium.
All right. As many of you know, I was away for several weeks last November. And when I came back, I was an inch taller, and I still can't quite stand up straight. All crooked politician and sexuality jokes aside, scoliosis is often a very serious condition that affects anywhere from 2 to 3%, or 6 to 9 million people in America alone. Scoliosis is defined as the condition of side-to-side spinal curves that measure greater than 10%. On an X-ray, the spine of a person with scoliosis looks more like an S or a C than a straight line. These curves may cause your shoulders or hips to be uneven, depending on where your curves are located in your spine. Scoliosis has been around for centuries, first discovered by Hippocrates of ancient Greece. It was his belief that physicians should have a foundational knowledge of the spine, as it leads to the understanding of many diseases. He came up with various implements to treat spinal deformities, such as the Hippocratic board, which involved traction and someone pushing down or sitting on the affected area, and the Hippocratic ladder, on which a patient was hung upside down and left to hang to straighten out. Patients throughout history have sought doctors' assistance with their diagnosis. Today, children are screened in public schools from a young age. This practice, called active screening, started in 1963 when Delaware became the first state to mandate that children be checked in schools. Today, 23 states now require active screening in public schools. While there remains debate about the value of screening, it is the position of the Scoliosis Research Society that frequent checks from a young age greatly improve the chances of identifying a child's curve early on. There are 3 distinct types of scoliosis that have been identified. The least prevalent is neuromuscular scoliosis. This type of deformity is an irregular curve caused by disorders of the brain or the spinal cord. These curves often continue to progress or worsen into adulthood and can be caused by traumatic paralysis, cerebral palsy, or other neuromuscular disorders. The second type is congenital scoliosis, which is caused by the improper formation of the vertebra in the embryo. These defects can sometimes not lead to scoliosis, but most often do. Oftentimes, congenital scoliosis is combined with kyphosis, or a hunchback, and is found earlier than idiopathic scoliosis. The third and most common scoliosis deformity is idiopathic, which means that the exact genetic cause is unknown. While almost 80% of idiopathic scoliosis is identified in adolescence, The remaining 20% is either infantile or adult onset. For all idiopathic types, girls are much more susceptible than boys. And for adolescents, the ratio is as large as 7 to 1. Adolescent idiopathic scoliosis, the type of scoliosis I was diagnosed with, is a genetic condition, meaning there's often a positive trait in families. For example, my mom's side of the family has had people with scoliosis going back for generations. My aunt, my grandmother, my great aunt, and one of my grandmother's cousins have all had scoliosis to some degree, up to and including complete spinal fusion. To review, there are 3 types of scoliosis: neuromuscular, congenital, and idiopathic. Going further, idiopathic scoliosis is also classified with a tiered system created by Dr. Lawrence Linke. Dr. Linke is one of the leading experts on scoliosis, especially in children. His 3-character classification was created when he realized there was no common system for describing curves, which led to confusion and mistakes in treatment. The first character in the classification specifies the location of the curve, whether it's in the upper or lower part of the spine. The second character designates how far the curve is from the midline of the spine, and the third describes how much the upper region of the spine is curved. This common naming technique now provides doctors and surgeons a simple way to communicate about various curves. The most common curve type is 1AN, pictured here. Treatment for these different curves varies. Minor curves are often just watched by the child's pediatrician to see if the curve progresses further. The patient has x-rays every year to prevent the curve from progressing without notice. If the curve continues to progress, doctors often recommend non-surgical treatments to attempt to correct the curve, such as bracing or physical therapy. If the child is still growing and their curve is between 25 and 40 degrees, a brace may be recommended to try and stop the curve. There have been improvements in brace design, and newer models fit under the arm, not around the neck. One of the most popular now is the Boston brace, which is created from a mold and has corrective add-ons to force the spine back into proper position. Other, older brace models include the Wilmington, Milwaukee, Charleston, and Providence braces. While doctors disagree which type of brace works best, studies show that braces, when used properly, successfully stop curve progression in about 80% of children with scoliosis, as well as giving them instant rock-hard abs. Deep tissue physical therapy is also an option for some. While not actively correcting the skeletal curve, methods such as the Schroff method and Rolfing can greatly improve the flexibility, pain, posture, and overall quality of life in people with severe curves. These methods attempt to loosen muscles and tissue by stretching and helping kids learn how to control their breathing. These exercises can sometimes help the patient return their spine to a more normal state. If all else fails and a curve continues to progress, doctors will often recommend surgery to permanently halt the progression. There are various methods of surgery to fix scoliosis, with spinal fusion being the most common. This procedure involves using bone graft to fuse sections of the spine together in order to stop the abnormal growth, often combined with pedicle screws and rods to help strengthen the fusion. An incision is made over the spine, pedicle screws and a rod are attached to the bone. The rods are then straightened, which straightens the spine. Then bone graft is packed into the spine, which fuses the vertebra. Other surgical techniques used to correct curves include ultrasonic spine therapy, inner body fusion surgery, and laser scoliosis surgery. These techniques all may sound intimidating, so let me tell you a little about my journey. This was my back. In early 2015, my mom noticed an abnormal hump in my back when I walked around the house without a shirt on. She Googled weird hump in back and found results for scoliosis. She contacted my granddad, a retired orthopedist, who recommended I go visit a specialist about my spine. We went to a local spine specialist first, and he took these x-rays, the first I had ever seen of my back. I was told I had a 47-degree curve in bracing was recommended. Some of you may remember me walking around freshman and sophomore year with my rock-hard abs. That was my brace, not my weightlifting. I wore it faithfully for about a year and a half until we learned the brace was not correcting my curve. We visited another local doctor who measured my spine at a 51-degree curve. He told us bracing most likely would not work and that surgery was the recommended option. Knowing that surgery was potentially life-threatening, my parents and I pursued other non-surgical options to try and improve my back. Over the course of the next year and a half, I tried both the Schroth method of physical therapy and deep tissue massage to try and halt my progression. However, neither of those treatments worked, so we decided to look into options for surgery. In the Augusta area, there is a spine specialist and a pediatric orthopedist, but no pediatric spine specialist, so we decided to look elsewhere. We chose Dr. Linke, who had performed a full spinal fusion on my great aunt 12 years ago. He is the leading scoliosis surgeon in the world, having published his studies over 200 times and patenting the hardware that was used in my back. In February of 2018, we first traveled up to New York to meet Dr. Linke and have x-rays done. Even in February, his surgery schedule was already booked through August, so we had time to make a decision. After much consideration and research, we chose to have the surgery in November of last year. We flew up to New York City on the Monday before my surgery to have a pre-op appointment and testing done late the night before. Almost before I knew it the next morning, I was laying in the pre-op room in a gown with Dr. Linke writing his name on my shoulder to ensure the right surgery was performed on the right person. I was given an IV line, wheeled into the operating room with 80s music playing, and 5.5 hours later, I woke up with a straight back. For those of you considering scoliosis surgery, I would strongly recommend against it, because man, does it hurt. I've never experienced that much pain, and I hope I never will again. Those first 3 days in the hospital were very long. I got very little sleep due to the pain, and the only relief came from strong painkillers and my music, the two things that kept me going. I somehow survived those days in the hospital, 2 weeks in a tiny New York apartment with a tiny bed, and one very long day of travel back to Augusta. My mom and dad helped me in every way they could, and I couldn't have done it without them. I recovered quickly once back in Augusta and traveled back to New York for a post-op appointment in early January, where everything looked amazing. This enabled me to play in a basketball game again, 2 months to the day after my surgery. I'm so thankful for everything Dr. Linke and his team did to help me through the surgery and recovery. Having now gone through the surgery, I just have one recommendation. Stand up straight and don't get scoliosis. Now I would end with a scoliosis joke, but that would be out of line. Thank you.